Pleasure for me. We excited your presentation and for your meet. Mohammad, you
Thank
can.
you. Nice to meet you.
Yes.
Our friends. Yes.
Yes. Mohammad, you can share your presentation.
Yes. Okay, do you have my presentation now?
Yes, it's okay, we see. I was worried about internet problem at Iran, but everything is okay.
Yeah, it's okay, and I hope to do not have any problem, and we'll
Yes.
do it, without any problem, inshallah.
İnşallah, yes. Now we are waiting other participants and other guests.
Okay, no problem.
Okay.
Bir misafirimiz daha mı var hocam? Nurperihan hocam.
Bir misafirimiz daha mı var? Ben göremedim ama.
Bir misafirimiz daha mı gelecek?
Yok. Ben yanlış mı anladım acaba? Katılımcıların da burada olacağını düşünüyordum. Tamam. O zaman yok. Tamam. Deniz,
Aha.
yanlış şey yaptım. Anladım. Konferansı dinleyiciler Teams'ten bağlanmayacaklar o zaman.
Şimdi linki atayım. İsteyen kişiler katılabilir. Bir link atayım hocam şeye. Çevrim içine.
Sabahki bildiriler gibi düşünmüştüm. O yüzden öyle bir şey yaptım, açıklama yaptım.
Evet, bir dakika. Saat 4 hocam. İsterseniz başlayabiliriz. Ben linki gruptan paylaştım.
Tamam. Dear Kalchan participants, today we will hold the digital conference of the 9th International Health Science and Management Congress. Welcome to our digital conference. Our conference will be held by Assistant Professor Dr. Mohammad Saadati from Khoy University, Iran. Before starting our conference, I would like to express my condolence to the people of Iran on the death of President Ibrahim Raisi. Dear Mohammad Saadati will give us a conference on health management and community development. Yes, Mohammad, you have to say.
Okay, thank you, Dr. Nurperi. It is my pleasure to attend in this prestigious conference, and appreciate you and your colleagues for organizing this conference on health management and community development. And I'm ready to start every time you are open, then I will start my presentation. Is it okay to start, or we are waiting for other participants?
It's okay for us.
Okay. Can I get your approval of seeing my presentation slides now?
Yes, we see your presentation.
Okay. Okay, my name is Mohammad Saadati. I'm PhD in Health Services Management from Tabriz University of Medical Sciences, and fellowship from WHO EMRO from in the field of non-communicable disease prevention. I'm now working with WHO as a health CCT consultant and also the Global Network of Safe Communities as accredited certifier. In this presentation, we are going to discuss a perspective of health management, which is, less discussed because most of the health management concepts are around the hospital or health service provider facilities management. In this presentation, we are going to discuss and reach a shared understanding of two important concepts that are health management and community development. And then we are going to explore health management and community development relation, their integration, how health management could be integrated with community development. And the final words will be go through the future health managers' functions toward community development. First of all, I would like to have a closer look to the world. If you see this map, this is a Human Development Index distribution in the world. And this map is the life expectancy in the world, in the communities, in the country, different countries with different level of Human Development Index. A quick comparison of these two maps gives us a clear message that each country or community have higher human development index. We are expected to have higher life expectancy and also higher quality of life for human. This will emerge from this map and the comparison of burden of disease in the countries with the human development index. If you compare these two maps, you can see that communities with higher human development index have less burden of disease. And this means that the quality of life for the human who lives in these countries is higher than the people who live in the communities with lower level of human development. I want to share with you two other maps and then start the concepts. This is child mortality by income level of community. We can see a steady lowering trend in all the countries, in all level of income in the world. But one thing is steady during the past, low-income countries have the highest rate of child mortality, even in 1990 and even in 2021. And this one is the share of population using safely managed sanitation facilities. And this is completely, versus of the child mortality trend. This is in this map, higher income countries are always in the top of the figure, and all the time, the share of people using and have access to safe sanitation is higher in higher. So the question is why there is differences. The matter is reference to community development. And what is the solution? The solution is community development, but with the perspective of health management. So we should have a shared understanding of community development, and health management to be able to discuss the health management role in community development. For this, we have to define these words. So I'm defining community as a group of people with a shared identity, a group of people with a shared value, shared cultures who are living in a community, in a geographical area. And the development, if you have a search on these definitions, you can find lots of definitions, but I believe this definition is the simplest and the most comprehensive one, which clearly define the goal of development. Development is a process, It is very important. It is not an initiative. It is not a program. It is a process that increases choices. It gives you various choices in various areas of, life, in various areas of your daily works that affect your life, from your eating, your housing, your work, your friends. These are, the result of development. So it involves change, improvement, and vitality, a direct attempt to improve participation, flexibility, attitude, and the function of institutions, and finally, the quality of life. So the development finally will affect our quality of life. The question is that, what is community development? If we want to define community development, you can find, definitions from various aspects. I have, abstract these definitions and provide the exact, clear definitions for the community development. The first one is a process where community members take collective action on issues that are important to them. Community members are thinking with each other, working with each other. They have participation. They have their organizations to work with each other on the issues which are important for their own local community. This will make development intended to communities. In this participation process, communities get empowered and enhance their skills, and also create stronger and more connected communities. These connected communities support each other, which finally creates further development for these communities. This was very important, that community development considers community members to be experts in their lives and communities. When a community member gets expertise in the life or a community, they can identify the problems, they can draw solutions, and they can plan, implement, and evaluate the interventions. And also, it highlights that and value community knowledge and wisdom. It's not something that's expressed from the out of the community. It's just based on the community. And the last one encompasses a range of efforts to improve the physical, economical, and social environment by promoting affordable housing, small business development, job creation, and social cohesion in the community. If you consider these statements all of these statements highlight some issues. The first one is highlighting community member empowerment, which is one of the one of the principles that with no doubt we are working on it in the health initiatives. The second one is the community members' participation. The members, community members, are deciding on what is important for them. And the third one is the local potentials and values for development. If you consider the last one, the last statement, the statement is highlighting the small business, the social cohesion, the affordable housing. These are based on the local potential and also value the local potential of the community. So if we consider the principles of the community development, we have empowerment. As it was mentioned in the statements, empowerment is a vital pillar of development. The community members be expert in their life and community. The second principle is human rights. Considering the rights of human in the development process, it is very important that human rights are such as education, such as health. So these are the base for human development. Inclusion. No one should be behind. This is also one of the principles in health promotion. Development is an inclusive process which affects human life directly or indirectly. Even you are directly involved or engaged in a development process or not, it will affect your life. And the other one is social justice. It is crucial aspect. Community development, which supports its effectiveness and success. If a community development approach did not consider the justice, it will not be successful, and it could not achieve the effect that is is behind and following it. The next one is self-determination. The community members should have active participation. This will help the members to determine themselves, determine their role in the community development, in their community development and their life enhancement. And the final is collective action. Collective action is including intersectoral collaboration, because the development is not just one aspect development. It is a collective, and it needs intersectoral collaboration to work on the various aspects of the society, which affect the human life, such as education, transportation, housing, construction, culture, social, and economic. So with this in mind, we are going to define the health management that is the second part of our discussion. Health management mostly is directed to the management of health facilities or hospitals. So I want to discuss and distinguish between two words which are used interchangeably. The first one is healthcare management. Healthcare management refers to providing leadership, management, and direction to the organizations which provide healthcare services and to different units within those organizations. This definition is the mostly used definition of the health management, which is just addressing the management of hospitals, the management of health centers. But I want you to distinguish with this word that health management embraces a holistic vision of health, in which health is impacted by behavioral, social, and environmental determinants. This is something that we are going to address in this presentation. So, until now, we had community development and health management. We want to know what is the role of health management with this definition, with the holistic vision of health in community development. So the health management in community development encompasses both individual and population level issues. It provides a holistic and comprehensive vision of health and impact on social, economical, cultural, and environmental policies. And health management, with the definition of that we, with the holistic vision, address not only social determinants of health, but also commercial determinants of health and SDGs. Commercial determinants of health are conditions in which individuals in the community are exposed with marketing, trade, commerce practices. Or in another word, is the private sector activities which affect the community. So this is something that health management will play its role in the community development. So future health managers will require different skills. They need to know about SDH, about the commercial determinants, and also SDGs. With this in mind, that health is an inclusive human right, we are going to have two main outcomes in discussing about health and community development. These two outcomes are healthy people, and the second one is developed community. These are two main outcomes that each community is going to achieve. When we are discussing and reviewing these outcomes relation, they have mutual relations. These outcomes are achievable in a context that follows health in all policies. It means that health manager and health management could play a highlighted role in shaping the policies in various stakeholders' policies to ensure that all policies in the various sectors follow the health principles and support and the environment for the health promotion. With this in mind, all researchers and health managers in the world have developed some interventions and initiatives that you can see some of here: healthy people or healthy community initiative, sustainable healthy cities, community health initiative, healthy village, safe community, and other initiatives which all are the role of health management in community development. These are efforts to integrate health management with community development. When you are talking about sustainable, healthy cities, you are considering the health management principles with community development, which SDGs, to create a community which sustainably responds to the community needs, to the health promotion needs, and other sectors. But integration of health management and community development, in this approach, we need to know the functions of health management. If you remember the principles of community development in your mind, I would like to explore the health management role in the community development process, considering these principles. The first function is intersectoral collaboration. The health management should be the core of intersectoral collaboration in the community development process. This will ensure the positive health impact of all sectors' policies, and it establish the health in all policies approach in the community. The second one is advocacy. Advocacy is a strategy to raise the level of awareness and promote health and access to quality health services, and also public health at the individual and the population and institutional level. It means persuading stakeholders to invest in health in the community. The community health is affected by the works, the policies, the initiatives, the interventions of various sectors which are authorities of a community, from the municipality, the governor, the education system, the police. All of them are related with health. So the advocacy is one of the important functions of health management in community development. The third one is public participation. When we consider health care management, we just talk about the patient participation, but in the holistic view of the health management, we are talking about public participation. Health managers should be equipped with the skills and knowledge of how to create public groups, how to have public participation using participation ladder and participation frameworks, from the tokenism to the active participation of people, and also adhere the participation ethics, which is something neglected in the public participation literature, and this is very important. This will make a strong relation between community members with development process and creating a belonging sense in the community member is a challengeable task for health manager in this regard. So a health manager should play a highlighted role in public participation. The first one is empowerment, that we talked and mentioned in the previous slides, but empowerment should be in individual and institutional level. The health management should empower other sectors also to consider health in their policy, to know how their policies impact the public health, to know how their policies impact the quality of life. And this is one of the important and base functions of health management for community development. The fifth one is community level planning, organizing, and evaluation. Most of health management contents are focused on planning, organizing, and evaluation on specialized services or within a healthcare facility. And but future health systems require this one for the health managers to know and to be able to plan in community level, to organize committees, intersectoral people in the committees, to organize the work within the different stakeholders, to intervene and start the programs for health promotion. And finally, could evaluate the impact of interventions and intersectoral collaboration on the community health. And the sixth one is to evidence-informed decision-making. Generating evidences through employing technologies And scientific methods is one of the important and vital roles of health management for community development. If this function did not work in its best model, the community development will have negative and on the public health, and will have higher cost for the health systems to compensate its injuries and its burden of disease. So this function provide evidence on impact of community development on health, or versus it means that how health can affect the community development. In conclusion, I can say that health promotion through community development approach is crucial for healthier people, and it is vital to integrate health management with community development approach. So it requires new perspective, rules, and functions of health management in the community, and future health manager functions are foundation for health and effectiveness, because without integrating with community development, we cannot reach the public population. We cannot respond to the non-communicable disease prevention. We cannot respond to the public, to the health services. Thank you again. I would like to thank you. I would like to thank you and Dr. Nurperhan for inviting me and making this opportunity for me to and
Yes.
and for participants for Q&A. Thank you.
Mohammad, it was a very productive and successful conference. You shared very valuable information with us. I would like to thank to you for sharing your valuable time and join us. If we have any question, can we get it?
Yes, please.
I think they are not a question. Dr. Mohammad Saadati, thank you. You touch upon a very important issue for the development of countries. Health service play a very important role in the welfare of country. I hope our cooperation and until will continue. We have a historical unity with Iran. I hope our relation and friendship will continue. Thank you so much again.
Thank you, Dr. Tursun, and thank you other participants for their time and this valuable opportunity. And I hope so to have to continue our collaboration with you, our brothers and sisters in Turkey. And thank you for the conference. And I hope so to have more opportunities in this kind, and have more research and educational collaborations with you and other colleagues. And
Thank you.
at the final, I want to say teşekkür ederim.
Also, we teşekkür ederiz to you. Teşekkür ederiz.
Thank you.
Thank you.
Okay, thank you. Goodbye.
Bye. Thank you.